Long hours, low pay. Those among other issues medical doctors continue to face. President of the Jamaica Medical Doctors Association, JMDA, Dr. Mindy Fitzhenley, says this is causing growing frustration with some of her colleagues. Shamala Pullen has the details.
The average salary for a medical doctor in the public health system, such as interns, senior house officers, and medical officer from 1 to 3, is lower than $200,000 per month. These medical doctors often work 40 hours per week, but with COVID-19, these hours have been extended to at least 98 hours. President of the Medical Doctors Association, GMDA, Dr. Mindy Fitzhenley, says the situation is even worse for medical doctors who work in the primary care settings who don't have duties or any additional source of income.
If you have even one child going to school, that would your salary would not be able to stretch. And another issue that we're having right now is that payments or deductions from our salaries are not being paid over to the institutions. So, for example, persons, their mortgages, their car payments, all of those things. Many persons are unfortunately in arrears right now with these institutions because the regions deduct it, but they're not paying it over.
In addition, they have student loans to pay. Dr. Fitzhenley explains in medical school, these doctors have to pay in excess of $20,000 per year in tuition fees.
And you haven't spoken about any of our equipment that we need to purchase, the stethoscope or diagnostic kits, which cost upwards of $600, $700 US again. Somewhere, transport back and forth to school. So it all adds up. And then as soon as you finish, then you have student loans to pay back. And it is unfortunately not uncommon that persons, when they get their first or second salary, the majority of it goes to student loan.
She says this is why the hazard payment promised to them from February last year when the COVID-19 pandemic started should have been paid. Dr. Fitzhenley says while it is not much, it can go a far way for some of her members.
Anata Bay is just another one of the locations. Although it has come to the forefront, it's happening island-wide. But Anata Bay seems to be severely affected where they've only gotten maybe 1 or 2 payments for the entire year that they have been trying to submit their forms. Other locations may have gotten maybe 3, 4, or maybe even 5 payments.
Dr. Fitzhenley said the association has written to the Ministry of Finance on the issue. So now it's just a wait and see. Shamala Pullen, TVJ News.